Hi, hello, ladies and gentlemen. Good evening. Namaskaram. Vanakkam. Welcome to a weekly Zoom show on this Sunday, 17th of July, 2022. Well, as we grow in age, as we grow chronologically, we tend to attract many diseases, many illness that makes us vulnerable, that make us inactive, that make us inefficient, that make our life very difficult to live. Well, one such situation is having a dementia. While dementia is not a specific disease as such, it's a culmination of few diseases which causes dementia, Alzheimer's being the main culprit. A dementia is a status where a group of symptoms tend to malfunction the brain, affect the thinking process, and social ability of the person is affected so much to disturb the daily life. Well, these kind of patients need a lot of care, a lot of attention, a lot of love and affection to keep their life going. The caretakers of these patients need a lot of positive qualities. They need, first of all, they need a lot of patience to bear with the trouble that the patients might be giving. The patients could be erratic in their behavior. We cannot blame them. The caregiver has need to have a lot of patience, a lot of understanding, and a lot of time on hand to deal with these kind of patients. Well, we are joined this evening by Geeta Iyer from Mumbai, who is donning the role of a caregiver, and she has been doing it for quite some time now, maybe for 4 or 5 years. She has picked up a lot of experience in this area. And this evening, she'll take us along the path and tell us how it all started. Well, then she's taking care of her own father. So she'll take us on a journey of how it all started. What are the problems she had to face? What are the roads she had to follow? Where she stands now? And what does the future hold for her? Well, this evening is going to be a very good learning experience for all of us. We can pick up a lot of input that she's going to give us. God forbid, if somebody in our family has to go through this syndrome, we will not be taken aback. We might at least be able to give some amount of relief to lead their normal life. Well, as usual, we begin the show with a prayer followed by the guest introduction. Then after the guest speaker takes over and on her completion, we'll have an open session wherein we all can put our views, observation, comments, feedback, and even ask questions which the guest will be more than happy to answer. And I'm sure there will be a lot of questions coming up this evening. And finally, we'll wrap it up with a summarization of the talk and a vote of thanks. All right, ladies and gentlemen, let's kickstart the show. Coming up first is the prayer. Well, prayer this evening is a special prayer to be rendered by Mrs. Nirmala Gurunathan, who joins us from Chennai. It's special because she's making a debut in our show today. Welcome to the show, Mrs. Nirmala Gurunathan. If you're ready, kindly unmute and go ahead.
Karuna Sadana Gajavadana Karuna Sadana Shri Gajavadana Karuna Sadana Shankara Bala Lampodara Sundara Gajavadana Karuna Sadana Shankara Bala Lampodara Sundara Gajavadana Ajanamani Branu Muni Parambaniyu Ajanamani Branu Muni Parambaniyu Pangaja Charana Charanu Charanu Pangaja Charana Charanu Charanu Shri Gajavadana Karuna Sadana Shankara Bala Lambodara Sundara Gajavadana நீயே முமுலர்கள் காதாரும் நீயே சிவகாம மந்தசாரும் நீயே முமுலர்கள் காதாரும் நீயே சிவகாம மந்தசாரும் நீயே வாழ்வில் ஜீவதாரும் நீயே வாழ்வில் ஜீவதாரும் நீயருள்வாய் சுமூக நீயருள்வாய் சுமூக ஓம்கார சபதன கருண சதன் சங்கர பால லம்போதர தரக சபதன Thank you.
Thank you, Nimla Madam. That was a wonderful rendition of the prayer, giving a perfect start to the evening show. It's a nice debut which you have made. We really hope you would join us more often than not in our future shows.
Gotcha.
Thank you. Last week, we had Mr. A.K. Ramakrishnan, who was joined by Mr. Kishore and P. Aravindan, and they put up an excellent Carnatic music show. That was a welcome change to all of us. We have had a series of speech programs all along, and this music session was an excellent one, very well attended, very well liked by all. But let's listen to what they did last week. All right, the entire video is available in my YouTube channel. Kindly log into my YouTube channel and watch the show. It was very, very interesting. Well, moving ahead, we come to the next segment of introduction of the guest. Mrs. Vijayalakshmi Nagarajan joining us from Coimbatore will do the honors. Mrs. Vijayalakshmi Nagarajan, kindly unmute and go ahead.
Hello, Subbu.
Yes.
என்ன எப்போ சொன்னேள் கெஸ்ட் இன்ட்ரோடியூஸ் பண்ணணும்னு என்கிட்ட சொல்லவே இல்லையே.
உங்கள்ட்ட சொல்லலையா? உங்கள்ட்ட தானே சொல்ல நினைவு இருக்கு எனக்கு. உங்களுக்கு இன்ஃபார்ம் பண்ணேன், மெசேஜ் அனுப்பி எல்லாம் பண்ணேன், நீங்க பார்க்கலையா?
ஓ! எப்பவும் போல மறந்து போயிட்டேன் போல இருக்கே.
ஓ, இந்த மருதி தான் இன்னைக்கு ப்ரோக்ராமே. உங்க மருதி பத்தி இன்னைக்கு நல்லா கேளுங்க, ப்ரோக்ராம் நல்லா பாருங்க.
ஓ! அதான் நான்
உங்களுக்கு
சொல்லுவேன் உங்கள்ட்ட, எப்பவும் ஜூம் மீட்ல யாரையாவது இந்த மருதிய பத்தி பேசணும். அப்பதான் எனக்கெல்லாம் யூஸ்ஃபுல்லா இருக்கும்னு சொல்லியிருக்கேன்.
அதுக்காக தான் இன்னைக்கு கீதா மேடம் வந்திருக்காங்க பேசுறதுக்கு தான்.
ஓ!
Is here to
அப்படியா?
discuss about
ரொம்ப
this only. So
சந்தோஷம்.
please go ahead and introduce the guest.
சரி, ஆனா அவளுடைய ப்ரொஃபைல் எங்க இருக்கு?
அதுவும் அனுப்பியிருக்கேனே உங்களுக்கு.
ஓ! ஆமா, ஆமா. இப்பதான் ஞாபகம் வருது. தேங்க் யூ
உங்களுக்கு
ஃபார்
நிச்சயமா
ரிமைண்டிங் மீ.
டிமென்ஷியா தான் இப்போ. உங்களுக்கு நிச்சயமா டிமென்ஷியா தான்.
இல்ல, இல்ல. இன்னைக்கு கீதா மேடத்தோட ஸ்பீச்ச கேட்டோனே அத எப்படி ஓவர் கம் பண்றதுன்னு நிச்சயமா எனக்கு
Okay, yes, yes. We are all waiting to hear her. Please go
ஓகே
ahead.
யா. ஸோ இந்த ஞாபக மருதி இல்லாட்டி டிமென்ஷியாவால என்னென்ன ப்ராப்ளம், டே டு டே ஒர்க் பண்றது, சாதாரண டாஸ்க் பண்றதே எவ்வளவு கஷ்டம் அப்படிங்கிறது நமக்கு புரியுறது. இன்னும் நம்மளாம் அதுக்குள்ள என்டர் ஆகல. ஆனா எப்படி இருக்கும் அப்படிங்கிறதுக்காக தான் நானும் சுப்பும் ஒரு சின்ன கான்வர்சேஷன் பண்ணினோம். இன்னைக்கு இந்த டிமென்ஷியா அண்ட் கேர் கிவிங் பத்தி மிஸ் கீதா ஐயர் பேச போறேன். ஐ திங்க் இட் வில் பி வெரி வெரி யூஸ்ஃபுல் டு ஆல் அவர் சீனியர் சிட்டிசன்ஸ். Right now, let me read out her profile. Today's chief guest, Miss Geeta Iyer, is an MBA in finance from Michigan State University. She was working in the US with multinational companies as a consultant, implementing financial systems for over 20 years. She has moved to Mumbai in 2018, leaving behind her career and home in the US. Her father, who was in the 90s, had started showing signs of dementia, and she wanted to be able to provide the full-time care he needed as his Alzheimer's progressed. In the past 4 years, her primary focus has been caring for her elderly parents. Over the period of time, she has also become a passionate advocate for dementia patients and caregivers and provide information on a topic that is widely misunderstood. So I welcome Ms. Geeta Iyer to our show. Now the stage is hers.
Thank you, Vijayalakshmi Madam, for the wonderful introduction of the guest. At the outset, I would like to thank my childhood friend Sujata Krishnamurthy on 2 counts, who joined us from Kalamazoo, Michigan, USA. I would like to thank her on 2 counts. The first count for introducing Geeta Iyer to us, and second for joining this show at a time which is with a time difference of as much as 9 hours. It's just about breakfast time for her. Kindly lift your coffee mug, Sujata. That's it. That's what we wanted to see. Okay, now it's time for the guest to take over, ladies and gentlemen. We'll all have a mic in mute status so that we do not interfere with the thought process of the speaker. On her completion, we'll have an open session. Geeta Madam, the floor is all yours now. Please go ahead.
Thank you, Mr. Subramaniam, and also Mrs. Vijayalakshmi for the lovely, very interesting introduction. You got me for a minute there. And I was just going to say, oh, it's okay, I can introduce myself, but that was very good. And thank you for Sujata for connecting us. I think all of you have heard the word dementia, and I think it's a very relevant and very important topic. So I don't claim to be an expert. I don't have any professional degree in this field. So most of the knowledge and insight has come from my experience as a caregiver for my father these past 4.5 years. He passed away in 2020. I'm now caring for my mother, who is 93. Fortunately, she does not have dementia. Is it okay? English la peshlama la Tamil?
You can have a mix of English and Tamil.
Okay. I think I'm more comfortable in English, but I'm very fluent in Tamil. But Tamil speech la kuttadilla.
English is
okay.
Okay, all right, that's good. So I think dementia has got a lot of stigma associated with it too. Nariya per adha patti pesradilla, around across the globe actually, and particularly in India. A lot of people are not very open about it, and I don't know if there is some kind of shame associated with it, and so there is a lot of misinformation and misunderstanding. one of them I just, in the introduction, there is no cure for dementia. I don't want to burst the bubble, but the good thing is it can be managed, and you can still enjoy life. That is the message. So, and one more thing, just because you have memory loss, I will talk about it. It doesn't mean you have dementia. So I know we all worry, once you forget something, you think that, oh, dementia. That is definitely not the case. So my journey as a dementia caregiver started in the US around 2016-17 and ended with my father passing away in 2020 November in India, in Mumbai. So I want to start by introducing the hero of my story, my dear father, Mr. R.V. Iyer. His story is probably very typical, for many in his from his generation. He grew up in Kerala. He came from a very large family, not very well off at all. So they were struggling, and the parents depended on the children to grow up and help supporting them. So he started working at the age of 16. He didn't have the opportunity of an education. So he after his matriculation, he moved to Pune and then Mumbai, not knowing the language. You've heard this story from other people, I'm sure. Not having, just coming to the city with some couple of change of clothes, not having any money, but then working his way up and working multiple jobs and really working hard. And he ended his career as an accountant, accounts officer with Bharat Petroleum. So he had a very sharp mind. He was very good with numbers. So I want to talk about, he had many interests. He was a very lively person. He loved meeting people. He was a very social person. He could never be alone. He was always out and about. And he was an excellent cook. So he was an exception in many ways, in the sense that when my mom had to go abroad to the US when I was just a kid. I was 11 years old. My sister had a baby, and my mom was away for a year, and he took care of us, me and my elder sister. I have two sisters elder to me, so we had three sisters. So my father would cook and then go to work, and he was that kind of a person. He never thought this was a woman's job, or none of that. And he was very interested in music. He was very much into sports. So all of us are interested in music. It all came from him, I think. And he wanted to give his three daughters all the opportunities that he did not have. So education was very important to us. And he deprived himself of many things, but he wanted to make sure that we studied and we got everything we need. It was a priority for him. So my sister is my eldest sister is a doctor. She's a physician. And she's now in Ohio, USA. And then my second sister, she is now visiting me here. She has a PhD in organic chemistry. So I just want to just give you, an idea that, from where he started and where, we all ended up. So, and also he was a social, I think, activist, and he was a social worker. He would help everyone. He was very well known in where we live. In fact, one of his friends used to refer to him as the Lion of Chembur. We live in South Indian, heavy, densely populated South Indian area. It's Chembur, and he was very well known here, and he used to refer to him as the Lion of Chembur, because he would always come forward to help everyone, a sweeper on the street to the maid at home, if they had any problems. And so he was that kind of a person, and he was a very deeply religious man and very disciplined. So he never missed his, the Sandhya Vandanam, and never missed it. And he was part of many religious organizations, and he started the Satya Sai Bhajan group in Chembur. He was one of the few people. So just that was the kind of person. But then he, because all of us were in the US, all three sisters, we insisted that my parents move to the US, which in hindsight probably was not the best decision for him, because the life is completely different in the US. So he was happy, he was okay with visiting for a few months, but completely moving. And that is what he was already, my father was 90, 89, 90 at that time. And he was already, probably the seeds of dementia had started, but we didn't know that. We just thought, old age, and he's being forgetful, and he's being slow and unsteady. And we worried about my parents being away from us. So they moved. And around 2015, he had several health issues. And then 2016, I think it started seeing some signs that were more than just, what you would say, oh, this is okay for for old, for his age. He was 90, oh, this is quite normal. And that's what we would tell him. But some of the things that were worrying for him, because he was aware of some of these, one was he was forgetting, he was always, he would do an hour of prayers. He would chant the Rudram, Chamakam every day without fail, and the Vishnu Sahasranamam. He had a routine. He was a very disciplined man. He was the first one to take a bath and, all that. He was beginning to forget some of those. And he would feel very sad about it. How can this happen? I've been doing this from my childhood. So then we would take the help of YouTube, and I would play it for him in the background, and he would chant along. That was fine. Then as it progressed, there were other symptoms that came up. One of them is, we talk about this term called sundowning. So it's very commonly discussed in dementia forums, sundowning. So when the sun in the evening, around 4 o'clock onwards, when the, dusk, that is when they start getting confused. So that would happen. And I did not know about this term called sundowning. So I was like wondering what was happening to him, because he would just be sitting there in the living room and he would suddenly move his hand like, I don't know what's happening. Like he didn't know where he was even. And sometimes he would think he was in a train. He was traveling in a train. And so we would try to convince him that, no, look at this curry leaf plant, look at this dining table, you recognize it. That's what we used to do. But we didn't really understand what was happening, why this was happening every day in the evening. There are things that they tell you to do, draw the curtains, you don't want to have shadows, confusing them. So there are things that you can do, and there are certain kinds of light that you can purchase for that. So this was one of the symptoms. Then we would also visit my sister in Columbus, and he would go there and suddenly get agitated. And he would say, you did not, I haven't packed my clothes. You did not tell me we were coming here. And that was not true. So we would have arguments about, oh no, I told you, you don't remember. This is what we would all have arguments. Because I had a job, I had a full-time job, and I had no idea what was happening, and we didn't associate it with dementia. I mean, I did not know what was happening. And then I remember once we went to a concert, and I could still take him out, and he was okay he could take care of himself. He could bathe himself, he could go to the bathroom by himself, and he would take a bath by himself and everything, dress himself. He could do most of the tasks himself. It is just these isolated incidents. So there were two examples I want to give. One was Michigan. There was a concert, Margay in Michigan. We have that. So he loved music. So I would take him. I took him, and after some time, again, I talked about sundowning. It was in the evening. It had been a couple of hours. And I was sitting in the front because I wanted to be focused on the concert, and he was sitting a little bit behind with my mom. Suddenly I heard him talk very loudly, and what was happening was he had become confused about where he was. And he did not know whether he was in India. He thought he was in India. He had become completely confused. So I had to come back and take him out and, take care of the situation. So that was one thing that I learned, that I could no longer take him for a very long time. I had to plan it, that I can still take him. And, sometimes there are a lot of people that could be confusing and agitating for him. So, another time, nobody was at home, but suddenly he couldn't recognize my mother. So it was nighttime, and he said, "Who is this lady who's coming to sleep next to me?" And so I was trying to convince him, but he was just not buying that. So finally that day I told my mother, "You go and sleep in another room, just leave him, let him be. We don't want to get him agitated," because he was ready to leave the house. He was like upset. But next morning I asked him, who is this? He said, "Of course, this is my wife." So everything was back to normal. So it would come and go. So there were all these symptoms, but it was becoming challenging for me because, and then at night I would watch, I would want to make sure that sometimes he would not know where the bathroom was. That happened once or twice. So we took him, my sister is a physician. So she said, this could be dementia. We need to get him tested. So I took him to a neurologist. And so they ran a bunch of tests. We couldn't do an MRI or anything, but because he would not go through an MRI. It can be very difficult. So some of these tests can be difficult for if it's already a little bit advanced. He was still in his early, so the diagnosis was, I think, mild to moderate cognitive impairment. So that is an early stage dementia. So that was the diagnosis. Of course, I didn't understand what that meant at that time. So it was like dementia progresses in stages. There are different maps. One of the popular one being there is a 3-stage map, like a mild, moderate, severe. And the other one is 7-stage. They map it, 7 stages of dementia, which is, again, the first few stages are early and the middle stage is, the few stages, and then the more severe stages. So I had things had started to become more and more challenging, and I didn't know how to handle a lot of situations. So I had to make some decisions. So I knew that it was going to progress. And there would come a stage I will need a lot of help, and I cannot just go to work and leave my dad it had already come to a stage that I could no longer leave my dad alone. Because earlier I used to go on business trips and I would leave my mom and dad alone, and they would manage. I would tell a couple of friends to look in on them, but they were okay. But now that was no longer the case. And if I had to take my mom for a medical appointment, I could not leave my dad alone. I had to, யாராவது friend கேட்க வேண்டியிருக்கும் வந்து உட்காரு, and I had to be careful. Not everybody has a knack, to talk to the person. So all these challenges were coming up. So I just made the decision. It was also, I had a few options: move to Columbus, where my sister was. And the other option I thought of was move to India. And that was a bigger decision. I kept thinking about it. It took me few months. And then finally in October of 2017, I just went over the edge. I walked into work that day, not thinking I'll quit my job, but there was something that happened at work. And I just decided, I gave my notice. I just quit. And then it became certain. I'm moving to India with my parents. And one of the reasons was we couldn't have moved earlier because our apartment, our flat here had gone for redevelopment. So we didn't have a place to move to. So it was going to be ready in early 2018. So I thought, okay, I will move once the flat became ready. I'll move. And I wanted to move as quickly as possible because my dad was already, I think, 92. Already 92. So I wanted him to be able to travel, and both physically and mentally, because romba advanced the traveling, going through security, even sitting in the plane, everything would be unmanageable. So luckily for us, our flat became available in April of 2018. So what I did was, for a dementia patient, you have to, you can't just move. You can't, this could push them to a different stage. Any major change in their life, it can lead to more complications and more challenges. And as far as possible, you want to avoid it. So because while in the US, I had already told my sister, I'm no longer coming to see you guys. You have to come and see Appa and Amma because it will be very confusing. So now this was a long move. So I came to the US, to India 2 weeks before the big move to set up the house, because you cannot have many things happening in the house with my father, the carpentry work and everything. So I came here, I set up the entire house, and I said, I don't want anything happening after my father moved here. It had to be a live-in condition. So same, I had challenges in the US because I had to sell my house and I couldn't show my house. If you have to show the house, you have to leave the house. The realtor would come, he would bring in the client. So I couldn't do any of this. I couldn't just keep taking my father out of the house. I had all those challenges. I decided I'm not going to sell the house. Then I had to get rid of the furniture. Even if I want to sell the house later, I had to get rid of the furniture. But we still needed furniture till the last day. So slowly we had to organize that. People would come to see the furniture. My father would wonder what is happening. All of these challenges were happening. But we moved here. I asked my sister to travel with me. I have made several trips alone with my parents, but I said, no, I cannot do this one alone. I need help if there are problems along the way. So she agreed. She came with us. And then once he came here, I think he did go to another stage, because until then he could go to the bathroom on his own, and he could take a bath on his own. But inga vandapra, he could never find his way to the bathroom. I mean, he could still go and take a bath, but he would go and come out. This is a common thing. They would go in, so they have not taken a proper bath. So I had to slowly, I had never had to give him a bath, or had never had to do any of this. But I had to be mindful of his, because he is also aware. You have to understand one thing. It is not like they don't know anything. They know, and they can sense. They know a lot of things, but they may not be able to communicate correctly. So they will just express in their feelings in different ways. So I had to be mindful of the fact that I'm respecting his privacy and all that, but still make sure he's clean and he gets the help he needs. So slowly, and the progression. He could eat on his own, but when he progressed to the middle stages, we had to get involved, with feeding him. And sometimes we had to help him get dressed. I could, in the US, I could just leave his clothes in the bathroom and he would dress himself. Sometimes upside down, ultava potunduvar. But he could take care of himself. I had to get involved, and then he would do it. So some of the things that I learned is have a routine. I tried to keep a routine for him. So he would get up in the morning. We're all creatures of habits, and he was very much a routine kind of person. At least the initial stages, he was like that. So we went along with this routine. So have a routine, but be willing to change that routine. Don't insist on the routine, because you don't want to agitate them. So in the middle stages, you have to take a bath. I've already had a bath. It is probably because he did not want to have a bath that day. He was tired or whatever. So what we did was, what I learned to do was not to force him. Adu oru periya problem aidum. So I would just go along with, okay, kulchacha, seri pakla. I would try. You keep trying, an hour later, because he would forget. An hour later would be completely a different person. So, I learned these things along the way. So have a routine, and then like his prayers. So I would play Kulchachana. I would come and I would begin. The routine was, he would have a bath, he would have his breakfast, and then I would bring him to the living room. I would turn on YouTube and I would play Rudram. So 1 hour adla poidum, or I would play some Carnatic music for him, and I would sit to hold his hand, touch. I started using touch a lot, a lot of the South Indians, you may know, we are not like we don't touch our, hug, but it completely changed. I was always hugging my father, kissing my father, and he needed that because our other faculties started diminishing. This happened in the US also. He completely, because of a health issue in the hospital, and he was admitted to the hospital, he was in the ICU, because of a lot of very strong antibiotics, almost completely, he lost his hearing. This is a big risk factor for dementia, for an elderly person, because they may already have other risk factors, but hearing is another, loss of hearing is another risk factor, because lot of these elderly people, they start withdrawing. So my father, who was once a very social person, he started withdrawing. Ellarum vanda kuda pesha maattar, because I think they are a little ashamed. And I want to give you an example here. What we tend to do, a lot of us, is when people come, because they cannot hear, or avarku puriyardilla, we started excluding them. Nammale patient irupom. And this is, they are aware of it. So US la oru thirva enachna enga friends ella vandirundha, and we were all, our paava thaniya sofa la ukandanda, naanga dining table patient irundhom, and suddenly I looked at him, and my father started crying. So I went to him and I asked him what happened. He said he thought that enakku enna exact puriyala, but avar enna nenichirukkarna, there is something wrong with him and we are discussing him. So there is a problem here with him, and he's already aware of his health issues. So we should not do that. This is something we should not do with anyone. When all of us have done it. We do it. So, and then another time, after coming to India, my aunt had come here. And generally, the problem is most people don't know how to talk to a person with dementia. So it is something that we have to learn how to talk to them and all that. So ava enna pandrana, avala exclude panni, we talk. So I had gone out that day, and I came in, and my habit was, as soon as I enter the house, I would go and sit near my dad. Our paavam thaniya ukkandirundha. My aunt and my mom were chatting. So he was just sitting by himself quietly. So I went in, as usual, hugged him, and I was holding his hand. I said, "So how are you doing?" And he said, "Everybody has forgotten me." So it was heartbreaking, because they may not always, my father that day, he was able to express, but they cannot always find the right words, so we just have to be mindful. I know it is difficult. We cannot always include them in everything, but have some kind of a routine that you're going to have some, like I had a routine of sitting with him, and I would talk to him. Now, what can you talk to him? For my father, I couldn't engage him in many activities because he was already very old. But now I'm thinking of a few things I could have done. Like just a ball or some activity, physical activity, or yoga exercises, or something I could have done. Or if they have still, a lot of elders can still play word games or simple. One thing is, you don't want to make it very challenging for them. Romba challenging, they will give up. You want them to succeed. So I would, for him, I would talk to him about the same topics, because that is an advantage with dementia patient, because they will not know that they have to, you just talk to him about the same topic 2 hours ago. This was much later, but initial stages, you need to, it's probably different. But I could, as my dad's dementia progressed, I could talk to him about the same thing. Okay, tell me about Bharat Petroleum. You were called the human computer. He loved to tell this story. When he retired, they referred to him as a human computer. So I would say, Appa, you were the human computer. You're so good. And I would just give him basic math problems. But as it progressed, he couldn't even do simple mathematics. So I stopped. I don't want him embarrassed. So I would talk to him about cooking. அப்ப அவனுக்கு சாம்பார் பண்ண தெரியுமா? எப்படி பண்ணுவேன்? அப்புறம் அவர், if I knew that he was, then he would say, yeah, he knows sambar. So it's like, yeah, of course I know. But அதுக்கப்புறம் வராது. Then I would prompt him. சாம்பார்ல வந்து துவரம் பருப்பு போடுவா இல்லையா? அப்ப ஆமா ஆமா ஆமா. அதுல என்னெல்லாம் வெஜிடபிள்ஸ் போடலாம்? முருங்கைக்காய் போடலாமா? வெண்டைக்காய் போடலாம். So I am the one who is giving the recipe, but he would just keep agreeing, yes. So I found ways to talk to him. And then I would talk to him about his brothers. He never forgot his earliest memories. He would forget, he had forgotten. This was sad. One sad thing about dementia is you lose the person twice. Once when they are alive, my father could no longer recognize me. He did not know I was his daughter. He did not know my mother, but he remembered all his brothers. He had 8 brothers, 3 sisters. But that became an activity. I would, keep mentioning first, that was an exercise. So these were ways we are always, one thing to remember is we are finding ways to connect with them because it is, as Mr. Subramaniam very correctly said, it is nothing to be ashamed of, but it is your disease of the brain. Dementia is not a disease. I will talk about it. Dementia, but a disease, Alzheimer's is a disease that could, for my father, it was most likely Alzheimer's, that causes dementia. Dementia is a group of symptoms. All the symptoms we were seeing with my dad, him not recognizing me, him forgetting where he was, all of these are symptoms. These are all dementia. But it can be caused by many diseases, not just Alzheimer's. So what I learned along the way is my father, he is usually lost. He doesn't know where he is. He doesn't know who the people around him are. There are very few things that are familiar to him. So we need to find ways to connect with him using those few things like music. I said I played those Rudram. He could still system la uri perku. So I would play with them. So he could connect. Oh, yeah, I'm with people who... Then I would mention his brother's name. So he knew that I was someone he was safe with. He was safe with me. And I knew his brothers. I knew It did not remember. It is very sad. It used to be very sad for my mother. Nammala theriyadhillaye appadina. I used to think, but namakku avara theriyadhe. I used to say, we know him. So we can still connect with him. We can still reach him and help him and make him feel comforted, So that was a lesson. So I want to say that this is probably the hardest job I've held. So, I don't want to, I know I'm sure I sound like a wonderful doctor who did an exemplary job, but I was not always perfect. I lost my temper. Some days there was a lot of dementia is different for different people. So whatever I'm sharing with you, it was for my father. But I've also talked to a lot of people who have similar experiences, but not exactly the same. Some things are different. So Chalaverudu experience different, but there can be aggression. So my father there are days for no reason, you could not go near him. Like I would walk in every morning, I would say, Appa, good morning. And he would give this wonderful smile. And, but other days he would just you don't want to go near him. He would be aggressive. He would be sometimes physically aggressive. And towards the end, it kind of, he needed help with everything. And he died the last 2 months. He suffered from urinary tract infection. That was also treating that became difficult because of his dementia, because he needed an IV antibiotic. And because of his dementia, we couldn't give it to him because and every day we could not poke him. So we had to give him something else intramuscular, and then he lost his appetite. And the last 1 week was extremely difficult to watch him. 4 days, last 4 days, there was no food and just drops of water. We were just wetting his tongue. He became, he was unable to communicate. But I want to, even that time, I want to emphasize this. They always know. They may not be able to talk to you because 4 days, the last thing he said to me, because he was screaming, the urinary infection, Nala, when he was passing pus. So he would scream, but then he would stop the next minute and I would hug him as Appa, romba valikkarada appa. Illiye, he would have forgotten he would have forgotten the pain. Then it would come back. So one night at midnight, he screamed and I just ran to his room and I just hugged him and I said, Appiyo appa, kashtapadriyepa. And he patted me on the back and he said, don't worry. So that's the last thing he spoke. He never spoke again. After that, he lost his ability to speak. And one day before he died, November 25th, 2020, this was very sweet. My sister called from the US and we were on a video call. So I said, Appa para Usha kupadra. And he had this slight smile because he was completely like a vegetable. So, he was skin and bones. He hadn't been eating. So I just lifted him up and I made him sit. He suddenly took my hand and gave it a kiss. So, he couldn't do anything. And suddenly I was like, it was just so, it brought so much joy to my mind. He still knows, he still can, they can always feel love. Everybody can feel love. They can feel love through touch. If you cannot hear, you cannot see, you have touch. If they can hear, they can not speak, nothing, music touches them. So there is always a way to connect with them. So I would keep talking to him. I would keep telling him, last few couple of days, I would keep playing chants because we knew it was near, would keep playing chants. And he died on Guruvayur Ekadashi day. And it was like he waited for that day. And so I played Sai Bhajans for him. I played Vishnu Sahasranamam for him, all the chants. And I kept telling him, Appa, you have fulfilled your duties. You've been your wonderful father. You can let go now. We are all happy. We are all doing well. So I kept talking to him even though he was not communicating with us. I didn't even know if he could hear us. And he was just, there was a blank stare. So he passed away, and another significant thing that for my people who are very religious and for believers, his cremation happened on Dwadashi. So apparently Ekadashi Maranam and Dwadashi Dahanam is very auspicious. So that's what he got. I have documented, I shared my experience very openly. I think Sujata has seen many of my videos with my dad. I would make him sing. One of his favorite songs that he sang always was Sabhapatiki Veru Deivam Samanamagama. So I keep singing Krishnani Begane Jagudodara. These are like songs, so I would keep singing those songs with him, and I have many, I have hundreds, probably thousands of video recordings. So one thing I wanted to say, the first half of my journey, it started with me not knowing anything about dementia. Nothing. I didn't know anything. So I reacted badly. There were a lot of arguments. There was agitation. But once I let go and accepted it, my father, the second half of my journey was about finding joy in this situation. So, okay, this is a new version of my father. He's still my father. So I started documenting my journey, actually. I created a Facebook private page. I didn't know how to document. So I started raw videos. Kartala, me walking in and saying good morning, us smiling, us laughing, some even bad moments. It was a private page. I started documenting it, and I shared it with a few of my friends. My intention was for people to see what it is like, that you can still connect with them. You can still laugh with them. You can sing with them. So life is not over for a person living with dementia. And you have to become informed. You have to become educated. I had to learn, and that's what I did. So quickly, if I can, that was my journey with my father. I put together very quickly a PowerPoint. If I can just quickly go through I want to talk about dementia. Can I share my screen? Can you, Mr. Subramaniam, can you allow me to share my screen?
Yeah, done it. I've done it.
Okay, it says, okay. Okay, so this is just a few slides about dementia and care giving. So caregiving is a popular term, but care partnering is, I'm trying to use that because I have, since I was an advisor at Amicus Brain Innovations, a company started by my friend. And I've also, I hosted many conversations with caregivers, care partners, as well as people living with dementia. So there are people living with dementia that, they can function normally. You just have to learn to adapt. They have to do things differently. It's for all of us, right? As we age, we have to learn to do things differently. So they prefer, the term that they prefer is care partner. So I will talk about that later. So here, let me just go through some of these slides quickly. So what is dementia? I'm trying to close this part of this. Okay, dementia is the name for a group of symptoms caused by a disease. Example, and I'm trying to not see this side. Okay. I'm not able to go back. Okay. So it, as mentioned earlier by Mr. Subramaniam, and also I had mentioned it, that it's a name for it's not a disease, but it's a name given for a group of symptoms caused by a disease. By example, Alzheimer's. So these are a disease that affects the brain. It is not a specific disease. Dementia is not a disease. So when your memory loss is severe to the point where it's affecting your daily life and ability to stick to a normal routine. This is, most people, we forget, the example in the initially, Mrs. Vijayalakshmi said, I forgot to, that I was supposed to introduce. I mean, that is an exception. We all forget. But this is affecting your daily life and ability to stick to a normal routine that you've done for years. You're finding it difficult to learn new things that are not very complex. So that is why, even with my father, I used to tell I got full-time help for him. I used to tell them, let him do whatever he can. Don't feed him if he can eat by himself. We don't want him, because he will forget how to eat. So you don't want them to forget things because they cannot learn new things. So you want to preserve whatever they already are able to do. Then you're also finding it difficult to complete tasks you're familiar with. And others are starting to notice that this is out of the ordinary. Then maybe other things, you may forget cooking, you may forget how to cook something that you make rice or simple things. My friend's mother, she used to do something very strange. They said she would keep making rice and she would hide it because she would find that she has already made rice and have 5 or 6 pots of rice. And then she would start hiding it, and she, like in weird places, maybe in the cupboard or in the fridge, I don't know, wherever. So these are not normal things that we do. Treatments can help manage the condition, but there is no cure, unfortunately. There is a lot of unknown with many of the diseases. So Alzheimer's, there is an assumption about Alzheimer's, what causes Alzheimer's, but it is not 100% perfect knowledge. So they think it's the most likely causes the plaques in the brain, and there are some most likely reasons, but and there is no cure. There are treatments that can slow down the progression. So definitely we need to get diagnosed. Like I went to a neurologist, you can go to a neurologist, or you can go to a clinical psychologist. So they will administer some cognitive tests and they can assess that. You can go to a geriatrician. So you definitely want to go, because one of the reasons you have to go for get a diagnosis is sometimes dementia, you may have symptoms that resemble dementia, but it may be actually cured, because it may be because of some kind of a deficiency, a temporary deficiency, or something to do with sodium not being okay, or so that is something that will be corrected and temporary. So you may feel confused, and that may happen, but that can be solved. So it may not always be dementia. You definitely need to go to a doctor, get all the tests done, and confirm that this is indeed dementia. And then there are medications that can slow down the progression, and you can talk to the experts. So according to US-based Alzheimer's Association, there are over, I think it was 4 million, I can't see that for some reason, people who suffer from dementia, with some form of dementia. I don't know how, okay, here. Oh, okay, here. That's how I didn't know how to minimize this. There are over 4 million people. Myth. I want to talk about a few myths. So dementia is just a part of getting older. So when I grow old, I will get it too. So a lot of people think that, I've heard it when I said to someone that my father has dementia. I said, oh, everybody is going to get it. That's very normal. And that's not true. I'm sure you all know people who are in their 90s or even 100. The other day I saw on TV a lady who's 105 years old, an Indian. She's running, and she was very articulate. So the normal thing is being healthy. So that is what is normal. Dementia is not normal, is it not a normal thing? It's an aberration. So the reality is dementia is not a natural part of aging. So don't be scared. Most people do not develop dementia as they age. Almost 40% of us will experience some form of memory loss after we turn 65. I'm not over 60, but I'm already forgetting a lot of things. So I think it's different for different people. But even if we experience memory loss, chances are still unlikely that we'll have dementia. A smaller percentage will have dementia, maybe according to the World Health Organization. After we turn 60, the probability 5 to 8% will live with dementia at some point. The dementia, so it's a progressive disease. We already talked about that. So it can get to the point that we are no longer able to take care of ourselves. So one more reason why we need to get diagnosis for ourselves, if we suspect, or for someone else, is so that we can plan. We can plan our finances. We can plan put our affairs in order. And so that is what it helps us do. But not talking about it is definitely not a good thing. We need to talk to an expert and prepare and learn about it. While we are not sure what causes dementia, we certainly know that some of the risk factors and underlying medical conditions such as diabetes and stroke, and just overall health is always a risk factor, right? Overall lack of health. What affects how I age? Okay, what is aging? So aging is a natural process of our lives. As we age, we experience gradual changes to our brain and bodies. But that is normal, right? So some of these changes affect our physical and mental faculties. We all age differently. Like I said, there is a 105-year-old lady who is running and winning races. But others, we have challenges earlier. But the important thing I want all of us to remember is, according to the World Health Organization, each person should have the ability to live a long and healthy life. This is considered healthy aging. So all of us will most likely live a long and healthy life. What affects how I age? Besides genetic factors, it depends on lifestyles and environments. I think this is all common sense, right? How you eat, and what kind of lifestyle you live, very sedentary, and you don't move around, you don't meet people, isolation, social interaction. I think this is wonderful what you guys are doing, that you have you have activities, musical music programs, and talks, and you're engaging with each other. So that is healthy, a healthy lifestyle. Generally, we can support healthy lifestyle choices such as challenging our brains. So you can, Sudoku or some kind of a brain exercise. Whatever we enjoy, really, we need to be doing an exercise that we are likely to stick with, right? It could be yoga, chess, or card games, or whatever. Just sitting with friends and discussing politics, anything. Now, eating healthy, being physically and socially active. So these do not guarantee a healthy life, just like diabetes. People who have lived a healthy lifestyle still get heart disease or diabetes, but it's the same thing. But these are risk factors. We can definitely mitigate the risks. Another myth is dementia happens only after 60. This is not true, because I have talked to a few people. I mentioned that I have interviewed a few people, and a few of these people had something called early onset. So if dementia occurs before the age of 65, it's called early onset or young onset Alzheimer's or dementia. So there are different things that can cause dementia early. When a traumatic, you may have an accident or a head injury, a stroke. So it's a very small percentage. 10% of total dementia population is diagnosed with young onset. There can also be, people with Down syndrome. They can get early onset. So there are risk factors. So the main thing is it can happen early. I know of people who have gotten dementia at the age of 45, even in their 30s. It is very rare, but it can happen. Dementia. So this one says dementia patients are not aware. That is, this is something I talked about, how my father was aware. Even in the end stages, he was aware. I think human beings are always aware of, to some extent. They may not be able to communicate. So most dementia patients know what they want. Their ability to communicate gets impacted. Changes in their senses. So there are different faculties they lose. My father couldn't see. He was almost blind. He had age-related macular degeneration, but he could still. He knew what was happening around him. Dementia, myth 5 is dementia is reversible. So this is the thing I talked about. Unfortunately, it cannot be reversed. Some forms of dementia are reversible. Like I also mentioned, it can be a temporary condition. But Alzheimer's, there is no cure. There is a progressive terminal condition and cannot be reversed. But medicines can help to manage the condition and slow down the progression. Dementia equates memory loss. And this is a very popular myth, because don't pay attention to the numbers. I just got them from different sources, so the numbering is not accurate. Dementia is more than just memory loss. So just because we have memory loss, that doesn't mean we are going to get dementia. So difficulty remembering very recent conversations, names, and events. Apathy is they become like they start to withdraw and they become disinterested or uninterested. So this happened to my dad. You could tell him a close relative died. It was like he didn't care. It didn't affect him. Depression. These can all be symptoms, but they need not be dementia. Other symptoms are impaired communication, disorientation. I mentioned that my dad would not know where he was. Confusion, poor judgment, behavioral changes. Swallowing, yeah, that happens in the late stages, end stages. They may have difficulty swallowing. So you may have to contact a speech therapist to help with that. All dementia patients progress at a similar pace. This is a myth. That is not true. Every dementia, every I know they don't like the word dementia patient. The term that is popularly used, preferred in the dementia arena is PLW, or a person living with dementia. So it is different. They're all different. So you may not have everybody may not have aggression, hallucination, paranoia, but it is possible. Anything is possible. This is another one. Person with dementia becoming incompetent. That is not true. So we want to have a timely diagnosis so that we can help them. Engaging the patient in mild stimulating activity can help. So they can, if they can play the piano, for example, here ladies playing, we should encourage them to do that. Take them for walks, whatever they can do. This is another myth that it is hereditary. Fact is, first degree relative, there can be a risk. Nothing is 100%. When a disease runs in the family with other choices, lifestyle choices, there is a greater risk. These are all just risk factors, but there is no clear correlation. This is, I already talked about it. They don't have to become violent or aggressive. This is another one. There is no point seeing someone with dementia as they won't know who you were there. Please, this is completely wrong. I mentioned that how relatives would come and not talk to my father, or they would stop visiting. Please visit. You know, they are people they know, and so it always helps. You go then, sit near them, to hold their hand. All of these count. They don't know who you are, but you know. One of my relatives came on her birthday, and she said, she's talked to all of us, but she didn't go and see my dad. I said, aren't you going to see my dad? And she said, avarukku theriyade. I said, no, avarukku theriyade, but ungalukku theriyum. So go and tell him it is your birthday. And, you know, so these are things that are very important. This is a huge thing. Life isn't worth living if you have dementia. I have talked to people with dementia, and they all feel like this in the beginning, but then they learn to find joy and live, enjoy things. They just have to adapt and learn to do things differently. So this is a huge myth. So keeping the person with dementia engaged, there are always ways to engage with them. Music is a big thing. Music is particularly powerful because somehow music is completely different. You don't need your normal memory. It is just like love, I think. You know, you recognize love. It's like that. You recognize music. Our memories of songs reside in a different part of our brain. Try to determine what simple activities, including group ones, they can enjoy, such as going for a walk, watching children at a park, or even just holding hands. The key is to try to keep them active and engaged. That is the important thing. You know, not just leave them, just feed them, clothe them, and then forget about them. No, they are people. They're real people with feelings, emotions. They never forget feelings. We never forget feelings. I think it's true for all of us. If someone hurts us after a point of time, many years, we may not remember what they said or did, but we may remember the feeling. So that is the same thing. We remember feelings. Just like anyone else, people with dementia need meaningful activities to fill their days. And the family can help with this the best. How family caregivers can find joy. So this is about the caregivers, you know, care partners. Finding new joy. You know, with my dad, he had become a new person, and it was the first half I was like burnt out. It affected me physically. I actually became bald. You know, I lost all my hair, and I had to go take care of that. So then the second half, it was about enjoying my time with my dad. So how can we find joy? So finding new joy. Many things can bring us joy, including focusing on the now. So just in the moment. I think that is the crux of living well, right? Living in the moment. Start with thinking about what the loved one enjoyed in the past. So, you know, I would always talk to my dad about his job or the sports he played, but don't get stuck there. They cannot do that anymore. That's okay. We just use them. You can show them pictures, understanding what brought joy, and then modify those activities and in the present. Okay. I mentioned why we want to use the word care partner. So that is basically takes a shift in the mindset about the person living with dementia. So when we use the word caregiver, we are the givers and they are the takers. They're taking from us, and they're always troubling us. And we are helping them, and they have nothing to contribute. When we say care partner, it makes them an equal. It kind of, we start recognizing their abilities to speak for themselves or communicate. We just need to pay attention. So don't just, even for small things like food. What would you like? What would you like to eat? But we have to ask in a very gently. We have to give them choices, not too many choices. So like my mom initially would tell my father, இன்னைக்கு breakfast என்ன வேணும்? Oatmeal, oats வேணுமா, இல்ல தோசை வேணுமா, இட்லி வேணுமா, உப்புமா, and he would get confused. Then I would tell my mom, don't do that, just give him one thing, or give him one or two choices, or just give him one choice. Idli chapadela, because then it looks like he is making the decision instead of just putting the plate there, that, oh, he cannot decide. So we are respecting them. We are recognizing their abilities to still make decisions. Preserving their dignity. So like I mentioned, that initial stages, giving him a bath, I always made sure that we are not leaving him without clothes for too long, and because they can still feel, and they have no control over the situation. So we want to be mindful of that, showing them the respect they deserve. So that's, these are a few things. So we are recognizing that they can still do a lot of things, and their life is still worth something. And they, I started valuing my father even more. I think this was the closest I felt to my dad, because I think first my life revolved around him. He became the number one priority, and he came first. So, but a lot of things I became very close to him, and that became, I look back on this and I don't regret any of this. And I don't remember being angry or any of those. I mean, I remember doing that with regret, but I'm so happy that I made these decisions, to move here and be with him, and spend the time with him. A few first principles of caregiving or care partnering: walk into their world. So you walk into their world. Don't force them to see things the way you see them. So if he says it is evening, okay, it is evening. This is in the later stages. Initial stages, of course, you can tell them, oh, அப்படியா, எங்க அம்மா also now she's 93. Sometimes she gets up and she's confused and says, என்ன இது கார்த்தால இல்லையா, evening, and she gets it. But my father wouldn't get it. And sometimes he would say, how old are you? He would say he's 50 years old. So initially I would argue with him. Nee eppadi 50 ah irkalam? You can't be younger than me. Nee enoda appa illaya. In my argument, but they cannot understand logic. You don't want to use logic with them. Don't argue with them. Just go along. You just want peace. And then another first principle, I didn't get a chance to complete this. Redirect. Argument, if they are agitated about something, just like how we do with children, you kind of distract them, redirect them to a different topic. Hopefully they'll forget after some time. And if we cannot handle the situation, leave the room for a little bit before it becomes a huge argument. This is very important. We always neglect ourselves. Taking care of yourself. Caring for a person with dementia can be very challenging. It can lead to burnout. So you find slots of time every day, even if it's for a few minutes, to get away from the person. Just do something else. Even if it is for 5 minutes, 10 minutes, sometimes it's not possible. If you're the only one taking care of that person, and if you're not able to afford help, there can be many reasons. But try, go to a different room and just do some breathing exercises or whatever. Listen to music or something. Get help if possible. For me, that was a huge thing. I had 24-hour help, hired help. Even though I was there, I was very involved, I had help. If you can ask family and friends for help, that will be great. Engage in physical activity, walks, gym, yoga. So for ourselves, taking care of our health. Join social groups unrelated to dementia. You don't want to be talking about dementia all the time. Pamper yourself occasionally, massage or spa or a short getaway. If possible, ask a family member to fill in. Support group. There are a lot of support groups. I learned the most, not from experts. I learned the most about dementia from other caregivers or care partners. Because you go to the support group, there are people like you dealing with the same situation and they understand the experience. And they can, how do you deal with the situation? We can discuss those issues and get tips. I have actually started a support group. It's on WhatsApp for people who are caregivers. I was also part of a support group before that. I want to end with some pictures of my dear father. This is before dementia, before and after. So these are my parents, R.V. Iyer and Lakshmi Iyer. This is in the US. I would take him shopping, and he was the one who would buy coconut to help us choose. And jackfruit, he's cutting jackfruit. I told you he was an expert cook. He had no lazy bone in him. This was actually, he's cutting coconut here on his 90th birthday. We had a celebration, and my mom was making Parippu Paisam or Pradhaman, and he's cutting coconut for that. This is his 90th star birthday. He's doing his, you can see, Appa doing his morning prayers. He never misses a day. I had posted this on Facebook. He's very disciplined. So he's doing his morning prayers as usual. And he said something, this is for all of us. He would say about life, his life before dementia. He said, I'm satisfied. That's what he would say. This is like, he would never miss his Ammavasa Tarpanam. So he had begun to forget all the mantra, the iPad la vechinde the pannindirka. This is him. He loved his great grandchildren. He has 2 great grandchildren. He's reading a book to his great granddaughter Kavya. This is with his Kirtan. So he's playing with Kavya again. This is our family, entire family in this picture. My two sisters, their sons, and go on long walks. I had taken, so you all live in a retirement community. I had taken him to a retirement community called Shanti Niketan in Florida. So he's taking a walk there. This was in 2015. He would walk long distances. This is after dementia. So he had become my child. So this was just maybe 4-5 days before he passed away. This was a few months before that. But I said that you can still have fun with them, connect with them. This is us having fun together. And this is my father having a good laugh. I have many videos of him singing. Unfortunately, I didn't have them ready for you to play. So I want to end with this picture. I live with dementia, but I still love nature. I love my dog, my grandchildren, my music, my life. You see, I'm still me. And though I may forget, I hope you won't. So that's it. Thank you. I think I went over. I apologize for that.
Thank you, Geeta, for the excellent, awesome presentation. In fact, we really thought it would go on and on for some more time. But very neatly presented. I'm sure when I could get some goosebumps as you were talking through the experience. I'm sure some of others also would have had it. On a couple of occasions, I saw you controlling your emotions, but I'm sure some others in the show would have had a flow of a couple of tears at least. I mean, I agree with the final slide that you need to take care of yourself if you have to take care of others. This is precisely what they tell you in the aircraft when you're traveling, and the oxygen mask comes down, you put it on first before you attend to others. You need to keep healthy, and then you can take care of others. Well, that's a very excellent presentation. Now, let me open up the session. I'm sure you have many questions to answer. Ladies and gentlemen, it's an open session now. Kindly unmute one by one and please go ahead. Yes, Vijayalakshmi, madam.
Good evening, madam. And your presentation was very, very systematic. Okay. And about your father's dementia stage. And after that, the definition about dementia and what are the precautions or what, I mean, the things we have to take care of the patients like that. It was very systematic. And I want to express, I was really emotionally moved by your narration. And your father was really a very, very blessed person to have a daughter like you. You have devoted your time and energy at the last stage of his life where he actually needed the help of the children. Thank you, madam. God bless you.
Thank you. I mean, we were blessed to have him as a father because he sacrificed his entire life for us. And now my mother too. Yeah.
Yes, I agree, ma'am.
Thank you.
Okay. Next year.
I would like to speak.
Yes, please. Yes, Mr. Ramkrishna.
Hats off, madam. I am Ramakrishnan here in mid-60s. You are told about everything. It's a very touching moment. One thing I would just like to ask you, as a layman, as a senior citizen, say I give you two cases, practical case. One is I'm in one room. I just want to take a red pen from my other room. I just go there, and then suddenly my wife asks something, and then I come out, and I forgot that that I have gone there to take the red pen. Now, this is one case. Number two, I go there, and same thing happened, but I come back. I forgot that I have gone. I wanted the red pen, and I would to understand as a layman. First one is a memory loss. Second one is the dementia. Now,
I think you got cut for a minute. Can you say the second one, what that was? I couldn't.
No, second one is
you're freezing
I want a red pen. I just go to the other room. I totally forgot. I come back, and in fact, I totally forget the incident. Now, is it that, in fact, because if I understand this memory loss is a prelude to your dementia. So if that be the case, the first one is a case of loss of memory. Second one is maybe the early stage or whatever it is, it's a dementia. At which point of time the the family members need to consult a doctor or somebody?
Okay. So I will respond to this with the disclaimer that I'm not an expert. So most of the experiences come from just going through this with my father and talking to a lot of people.
Yeah.
So definitely, as I said in the beginning, and also in the presentation, memory loss need not mean we all go through memory loss. That's what happens. So memory loss doesn't mean dementia. And I also walk into a room and I forget why I came there. We are all, and especially I think the lifestyle has also become like that. We are not focusing on one thing. We are doing multiple things, and we are watching TV and eating. I mean, we are not focusing on anything. So I think that affects your memory too. You're not as sharp anymore. I think when you should go to the doctor, I think if it's out of the ordinary, like with my father, I said, suddenly he would not know where he was. He would forget where he was. He would think he's in India, and he would, so, and if it repeatedly happens to you that you just had a conversation and you forgot about it completely and keeps happening, that need not mean dementia. But if people around you are noticing and they're mentioning something, that wasn't there before, and it's more significant than normal memory loss, I think it's a good idea to go and get yourself checked out. Maybe you will come back knowing that, oh, you have some kind of a vitamin deficiency, or that is causing this, or something like that. So you may, or at least you can be at peace that this is not dementia, because if it is dementia, you need to know, and so that you can plan, because you need to you need to learn to manage it. With medication, you can slow it down. It is not the end of the world. You can slow it down, and you can still do a lot of things. You can live a normal life. I mean, there are things, that, okay, this is happening. And then you can put your affairs in order. Maybe you need to give a power of attorney to someone for your finances. Okay, if this happens,
True.
okay, I mean, those kinds of decisions you can make. So you need to, it helps you plan. In a diagnosis, helps you plan. So I would say there is no harm if it's happening repeatedly, and if you're becoming more and more concerned about it, go to a neurologist or a clinical psychologist and get a memory test.
Because in this case, the person concerned may not be aware of, realize that he would have to go to.
Yes.
Only the person who is in the house will understand.
Exactly. So family members need to pay attention. Yes.
Correct. Thank you.
Yes.
Thank you, sir. Thank you very much. Next year is Saraswati.
It was very informative and excellent. It is only that I can say. ஒரு இடத்துல ரொம்ப I was really touched. அவருக்கு என்ன தெரியலையேங்கும் போது நமக்கு தெரியாது. எனக்கு ரொம்ப it was really touching, and it was my eyes were welled. It was such a emotional moment. நம்மளோட வருஷம் பழகி அவருக்கு நம்மள தெரியலன்னா அந்த மாமிக்கு பாவம், she must have undergone how much அவரோட அது I would say நீங்க something really great, and Amma, you, all of you are really wonderful people, and you are doing a lot of research on it, and it's great, and you are imparting the knowledge, and that's also really great. I really appreciate. Thank you so much.
No, you're welcome. No, actually, I want to add one thing here. Something came to mind. Sometimes there were moments when he was aware of it, because in the later stages, suddenly, and that was very hard. Those moments were hard for us, because suddenly ஒரு நாளைக்கு அவர் அழ ஆரம்பிச்சிருவார். அவர் சொல்லுவார், நான் என்ன பாவம் பண்ணினேன், எனக்கு என்னோட குழந்தையும் வைஃபையுமே தெரியலையே. He would say. So that would have hurt him so much, because he at that moment he was aware of the fact that these are my children, but I don't know them. So, but அப்புறமா அது கூட போயிடுது. இந்த apathy சொல்றானே, அந்த like he was just living moment to moment அந்த மாதிரி. Yeah, it is a challenging journey, but I think love always conquers everything. You just you can still find ways to enjoy with them and make them laugh. நிறைய தடவை I don't want to make everybody cry. அவர் வந்து நிறைய joke சம்பந்தமே இல்லாம ஏதாவது சொல்லுவார். அது it become a joke, like once he was trying to explain to the attendant. I have this video of this. Loka samasta sukhino bhavantu. So he's trying to explain to this lady what it means. He's telling her it is a Sanskrit verse that means எல்லாரும் நன்னா இருக்கணும். So அவ சொல்றா, எனக்கு she's saying, எனக்கு மராட்டி தான் தெரியும், எனக்கு ஹிந்தி தெரியும். எனக்கு நீங்க எவ்வளவு படிச்சிருக்கீங்க, உங்களுக்கு இங்கிலீஷ் தெரியுது, சான்ஸ்கிரிட் தெரியுது, ஹிந்தி தெரியுது, you are a great person. எனக்கு ஒண்ணுமே தெரியாது. she's saying I don't know. எங்க அப்பா உடனே பட்டுன்னு, சாப்பிட தெரியுமா? So we all started laughing, So there are moments like that when you learn to enjoy. So there is a lot of laughter also we have.
Okay. Pujatuga. Mic on பண்ணுங்க.
Thank you very much, Subbu and dear sister. Your talk was most educative and wonderful. I want to be very short. I am plus 83. I want to know, is there any preventive step I can take to save myself from this problem? Already I am keeping my brain engaged by doing Sudoku, that the new wordly puzzle, etc., etc. And although I am mostly engaged in Advaita, you know that, Subbu. So my only question is how to take any preventive step. That's all.
I think you're already doing that. I had mentioned that in the talk also. Lifestyle, what you eat, everything, matters. Keeping yourself healthy. Physical health also is important, because if you have other illnesses that can affect your brain, this is something which affects your brain. So you want overall physical health. And also you want to keep your brain engaged, which you're already doing that. It's social engagement, I said, which all of you are doing. I'm a big fan of retirement communities. நான் எல்லாரும் அமெரிக்காக்கு போகாதேங்கன்னு சொல்றேன், கூட்டின்னு போகாதேங்க
One more thing. My sleep at night is very much affected. I sleep only for 2 hours or 3 hours. That's all.
Oh, maybe you
So
should
that
talk to
it doesn't affect my freshness, but I don't sleep. That means the whole night I keep awake, and I do go through the mobile and other things to keep busy.
Okay.
And also very limited, so that I become addicted to it. So
I
anyway,
think mobiles in general, I don't think they are good. We all do it. We are all addicted.
I know.
But I think that also affects your sleep, because they say, turn off your mobile an hour before your sleep time. Have a regular sleep time, which is not very late. 10 o'clock or something. But now advice pandradilla. These are like the principles. So they say that you don't want to sleep very late. Sleep is very important at all ages. You need at least solid or 5-6 hours of sleep minimum, at least good quality of your sleep. It's not that you're lying in bed for 10 hours. It is like the quality of your sleep. So அது ஒரு chronic problem இருந்தா டாக்டர் கிட்ட பேசலாம். But I think we are all doing things that we already know affect our sleep. Just like the mobile and TV வந்து ரொம்ப லேட்டா பார்க்கிறது, a lot of those things, phoneல நிறைய நேரம் பேசிட்டு. So I think those are all factors that affect. And having said that, I recently took up a job after 4 years. I just started working, and I worked the night shift. So I work from 7 p.m. to 4 a.m. So I'm not the person to talk about this, but yes, sleep is very important.
Yeah.
How young are you, Manisha?
Pardon?
How young are you?
Me?
Oh, I am 83 years young.
Sorry, sir?
83 years.
83.
Then
you are very young.
83 is young. My father was 92 when he got dementia. So, and there are people who don't get it at all. So like I said, just because you're over a number, a certain number, that doesn't mean dementia, we don't have to think.
No, the point is, I keep very busy with the certain groups in Advaita. You know Advaita?
That's very good. That's very good.
Yeah, that is in the Facebook. I also keep busy with the J. Krishnamurti, JD, Hittu Krishnamurti.
Yes.
All these things keep my brain always engaged. But I have not no such worry, etc. Only even lack of sleep doesn't affect me. But I feel how to get some solid sleep. I am not getting that only.
No,
Anyway,
I'm not the person to advise, but maybe they say that meditation. I mean, we need to be disciplined about our habits. We need to be very disciplined about the phone and turning off and all that. So there are so meditation can help, yoga, pranayam. All of those things can help. Discipline is very important.
One more point. When I feel there is no sleep, I chant some mantras. For example, Gayatri mantra or Rudram Jamagam little bit. That helps little bit, but it is not always very helpful. Anyway, it doesn't matter. Thank you very much. I feel very happy to have heard your very illustrative and educative talk. Thank you. God bless you.
Thank you. Thank you so much.
Thank you.
Sujata Vardarajan, you want to say something?
It was a very, very informative talk, and I really I got a lot of information there. And I'll just put a video also.
Yeah, camera on, please.
Yeah. Oh, hello.
I want to see you.
Yeah. Hi.
Go ahead.
I listened to this full program, and it was very informative, and it is very emotional also. But you have done a great thing of looking after your father, which is the most priority thing in this type of situation. A nice talk also. Good.
Thank you so much. I'm glad it was informative to you.
Yeah.
Okay, we move to the final segment for the summarization and vote of thanks. Mr. R. Subramanian, Secretary Tapovan will do the honors. Subramanian, sir, kindly go ahead.
எல்லாருக்கும் நமஸ்காரம்.
Namaskaram.
இன்னைக்கு program is a very serious program, not one of the lighter ones. And probably many of us who are in the age group she was addressing, they need not get disturbed over it. It is better to realize that could be one of the possibilities, though it is quite informative. And we are thankful to Mrs. Nirmala Gurunathan for her prayer. And we should thank Subbu and Vijayalakshmi Madam for putting up the, I won't call it a conversation, it is a sort of a skit in which you are expressing themselves and fooled us in the process. Whether it is really Subbu has become so much forgetful that he is not able to give the information and make her aware that she should be talking today. Anyway, it turned out to be all well. And glad to know, madam, you are a MBA from finance and you talk more like a clinical psychologist. I do not know whether I'm using the right word. And all you sisters have studied in US. One did organic chemistry, one is a doctor, and you did MBA from Michigan. And you have moved over here to take care of your father, which is a very great thing actually, because many of the dementia patients have a very difficult time and they find themselves in some homes, and it is difficult in this country. It has been pretty bad. I told you, you gave a very seasoned professional talk, and you went about the story in a very, very systematic way. The way in which your father started the life in Palkad and how he was in a very large family. At the age of 16, he needed to go to Pune, start serving somewhere to earn some money, and eventually how he ended as a human computer with BPCL as an accountant. That was a good account of a person, and how you were, his 8 brothers and 3 sisters were providing support, and how vividly he remembered, notwithstanding the problems he was having, to recollect their names. That was something great. And you said that you had your own problems in the first half. Your patients deserted you more often than not. Later you reconcile that this is what his life is. We were just wondering, we thought you would be mentioning something about your husband and his role in the whole process. Maybe he is not here.
I'm single.
Oh.
I never married. Yeah.
Okay, maybe that has helped your father really. And it is a great service you have done. And he was the Lion of Chembur, you said. It was just listening to your very, very serious story as such. We didn't feel we are listening to your lecture except for the 27 slides you showed you later. And we thought these things come once you cross a particular age. Some of the things don't touch you. That has been a myth which is not put up. And you said that once he was in his 90s, he got it. That was a bit surprising to us. And those are fortunate, as you say, who are over 100 are able to maintain their mental balance. Maybe that is there in their genes, or they have been keeping themselves occupied, as you said. And you gave us a lot of hopes towards the end. It is not hereditary. Some of the practices can really help. and the problems they face, they really forget where they are, what they are doing, they forget the routine, and they become more of a child. And once they get belligerent in some cases, it becomes more difficult to manage them. And uh, you know, you came 2 weeks earlier to get the house ready, leaving the house there. That was a piece of good information. As a daughter, the way in which you made arrangements for him to come and settle down over here. And people who move with them, it is very difficult to educate them how they should be interacting. Because they come once in a while, they are not aware of the problems. No one has really educated them, and they talk, and you said, I have become nothing in the family, as your father used to say. This is very common, and I don't know whether you found any solutions. It is difficult because people want to talk the least to them because they don't find anything common to talk to them. We can't blame them for that because they are not aware of the problems as such. The old stories really bring them a lot of excitement, as it is said that as you get old, your older stories remain well intact, whereas what you ate yesterday, you forgot. And people in 70s are the group you have talked to, and they don't remember much, but you gave them the comfort. This is nothing to be felt serious about if they want to go. Unfortunately, it is considered a stigma still. There is nothing routine about it. And people think that dementia is equivalent to Alzheimer's. You clarified it. It is just a symptom of Alzheimer's. Alzheimer's is much more dreaded. And how they enjoy music and how they enjoy things that they love most, and they would listen to them to keep them happy. What you said is they have feelings, they may not be able to express it, they do they do care for people, and they may not be able to, vocalize it, but what they have is intact, and that should be respected. And you said that God was at the end very kind to take him to moksha and Guruvayur Ekadashi day, and that is something great. And your slides, you could send it to Subbu, whoever wants to see as relevant. And unfortunately, many of the things, people who are in the vulnerable age are not interested in knowing because it scares them more. But that is the ground reality. And your tips were really useful. And hopefully, those people who listen to the lecture today will follow some of the practices which you have recommended and keep this off and not fall in the 8% of the population that get affected. And of course, we need to reconcile. All of us have some degree. Once it does not cross the threshold, we are comfortable. Thanks a lot for your evening. Thanks a lot for, systematically presenting. I don't know whether you are presenting in other forums, but it was an interesting talk. But all the same, it gives a little bit of chills up the spine for some of the people. But that is the reality. We are exceptionally grateful for your time and your lecture. Thanks a lot, man. Bye.
Thank you, Subramanian sir, for the wonderful summation and word of thanks as always.
Thank you.
Thank you, Geeta. Yes, please. You want to say something?
No. I was on mute. I just said thank you to him.
Okay.
Yeah.
Thank you for your valuable time, Geeta madam. The underlying point message that we get is if you want to be a caregiver, you need to have tons and tons of patience. You can't be temperamental. So you have to go along with the patient and be as patient as possible and try to help them. Thank you, Vijayashri madam, for the introduction. And the idea of a skit was Vijayashri madam's idea. She wanted to do it that way.
Oh, it's very good. It's a great
Thank you,
idea.
Sujata Madam, for your wonderful prayer. Thank you, ladies and gentlemen, for joining the show. Thank you, Sujata Krishnamurthy, once again for introducing Geeta to us. The recording will be uploaded sometime tomorrow or day after. Kindly share the link as widely as possible. And that's a wrap up from all of us over here. Until we meet next, here's wishing you goodbye, good night, and Shubh Ratri.